is the empty lot right here that used to have apartments and houses on it. The last apartment was abandoned and we used to always use there.
How often?
Almost every day.
Susan Ireland moved to Imperial County from San Bernardino 11 years ago to escape an abusive relationship, a painful custody battle, and a commanding heroin addiction. But the move was only the beginning of a long and windy road to recovery. Back then, heroin and meth trafficking were picking up there. The border-adjacent county was seeing the beginning of an epidemic, one officials say is making a comeback today.
It was easy access. I had a vehicle. I could drive to Mexicali or here to El Centro and pick up the drug easier.
Ireland spiraled, got well, and spiraled again over the next few years. The cycle made its last round when Child Protective Services stepped in.
They were going to adopt the young ones out. I overdosed on heroin and I was staying in a motel, and the guy that worked at the motel found me, raped me, and called the cops. And I woke up in the hospital 2 weeks later, clean and sober, pregnant. And that's why I'm clean and sober today.
The pregnancy and her legal trouble pushed her into parenting classes through the county's Behavioral Health Services Department, and that introduced her to a psychologist and group therapy. Michael Horn heads behavioral health in Imperial County. He says Ireland's indirect path to addiction treatment is common.
We get them into the prison system. We get them into the courts. We get them in the child welfare system. But they don't necessarily ever end up over in our system seeking substance abuse treatment.
Horn says that could soon change. California is the first state to opt into a Medicaid pilot that will allow health providers more flexibility in billing for substance abuse treatment. Historically, Medicaid, or Medi-Cal here in California, has largely only reimbursed counties for group therapy. Horn says better coverage could mainstream individual therapy, residential treatment, and medication for people with substance use disorders.
The overall goal is to finally get into modern times with the treatment of substance abuse. You know, we have kind of been saddled with a one-trick pony in treating substance abuse in this country for a long time.
And even support for that has been scant. Around 2010, the county ended most of its group sessions because Medi-Cal wasn't paying enough to cover overhead costs. It's a trend that's happening nationally. From 2003 to 2013, the number of state and local facilities treating substance abuse dropped 25%, while the number of for-profit facilities grew 34%. Zoom into Imperial County, and something a little different happened. County-supported centers closed their doors and outpatient services dwindled. But in a county known for low incomes and high unemployment rates, it wasn't for-profit centers that stepped in, it was churches.
This is where in the morning, they do their Bible study. They get in here and they have their little devotion. And they have a little Bible study right here.
Luis Barajas is a supervisor at the faith-based recovery home Turning Point in nearby Holtville. He was addicted to meth for 35 years before a court ordered him to Turning Point. Now he shares the scripture that helped him sober up.
To live right correctly, you know, not to have to be dependent on that addiction. You know, to be able to focus on God and let Him lead me through my life. You know, before it was the drugs leading me through everything I went through. Turning
Point is one of 7 homes in the area run by religious groups. Barajas says about 1,000 men come through his doors each year, about half because of court orders. Barajas doesn't have data on how many of them stay clean, but says there's no better way to help addicts.
I had a psychiatrist told me one year, you know, how many years have you been, you know, go to college to learn how to do this? And I told him I've never been to college. And I asked him, how many years have you been an addict? He says, I never in. So how do you know how that addict's feeling? How can you tell what that addict's going through? I know what he's going through because I've been down that same road he has.
Julie Myers is a San Diego-based psychologist specializing in addiction. She points out that there's no conclusive data showing faith-based homes like Turning Point or other self-help methods work. One reason is a lot of those programs lack follow-up, or they're altogether anonymous.
Most of my patients, probably 70% who are coming in with an addiction problem, have had multiple treatment failures. So they almost all have been in a 12-step model. Either they've just gone to AA themselves or they've gone to a rehab that's been 12-step.
Myers says to treat addiction, you have to get at the underlying mental health conditions driving the behavior. Susan Ireland says the personal insight she gained in therapy was instrumental in her recovery.
I wanted to know why I was feeling that way. I wanted to know why I felt everybody was seeing me the way that I thought they were. In all reality, it was just myself.
Behavioral health director Michael Horn says he doesn't plan to block the paths to recovery laid by religious groups and former users. He just hopes the new funding will open a few more.
She helps us with facilitating our Spanish individuals.
Ireland says it was the combination of professional treatment and various groups that got her clean and keep her clean today. She's working through the 12 steps a second time. This interview is step 5.
I have a recovery calendar on my phone of how many days clean and sober, minutes, and everything. So I have 7 years, 88 months, 383 weeks, 2,683 days, 64,404 hours clean and sober. And I carry this with me every day.
Megan Burks, KPBS News.